Okay, ma'am. I'm going to take your blood now. Hey, what's wrong with the new phlebotomist?
I heard she recently graduated. Online.
Okay, here I go.
Ever think you're gonna end up like this phlebotomist?
Hi, my name is Dr. Chameleon, and today I'm going to teach you rules that you should know as a phlebotomist. You see, phlebotomy involves some invasive procedures, which can cause harm to others as well as yourself. Through this video, we will present to you the rules along with real versus ideal scenarios so that you may become a more competent phlebotomist. So, what are these rules, you may be asking? Well, I'd like to present the 10 Commandments of Phlebotomy.
Okay, ma'am, I'm done taking your blood. Just apply pressure on the wound, okay?
What this phlebotomist did was completely wrong. If I ever saw this, I would kick her out of the hospital. You see, this phlebotomist failed to wear her PPE, in this case, her gloves, and then she decided to recap the needle this way. You never recap the needle. Instead, you take the needle and put it in its appropriate sharps disposal container. But if you really must put a cap back on the needle, you should use the scoop method to avoid needle stick injuries. Needle stick injuries are one of the most commonly encountered injuries in the clinical setting. It can lead to life-threatening diseases. This is why it's important to use appropriate technique, equipment, and control.
Okay, ma'am, I'm done taking your blood. Just continue applying pressure on the wound, okay?
Ah, much better.
Oh my gosh! You're Diva Smith! You're that celebrity! Guilty as charged. Oh my gosh! Wait, these are your test results. Oh my god!
Okay, this should be self-explanatory why it's completely wrong. Let's see a more realistic scenario.
Hello, are you Miss Diva Smith? Yes. Okay, here are your lab results, Miss Smith.
Did you catch the mistake? That's right. The phlebotomist stated the patient's full name instead of asking the patient to state his or her full name. Sometimes people are not paying attention or may want to impersonate someone else, which is why they would easily answer yes. To avoid releasing lab results to the wrong person, make sure to let the patient state their full name.
Hello. Are you waiting for your lab results?
Yes.
Okay, ma'am. Can you please state your full name?
My name is Diva Smith. I came in like a couple hours earlier.
Oh, no worries, ma'am. Just sticking to protocol. Here are your lab results, Miss Smith.
Thank you.
No problem.
It's pretty hard to find her vein. Maybe I should just insert the needle at a higher angle.
Okay, ma'am. I'm going to take your blood now.
This is just terrible. Many sources say that using a 15 to 30 degree angle is best for needle insertion. This helps you assess the depth of the vein, helps you avoid passing the vein with your needle, and to avoid hitting tendons, arteries, and nerves. Of course, this doesn't mean that you should carry a protractor with you everywhere and with every patient, but you should practice using a lower angle.
Okay, ma'am. I'm going to take your blood now.
Any phlebotomist should be familiar with blood collection from the antecubital fossa. Usually, there are 3 types of veins we can extract from. Of the 3, the median cubital vein in the middle is the vein of choice for 4 reasons. Number 1, it is more stationary. Number 2, puncturing is less painful for the patient. Number 3, it is usually closer to the surface of the skin. And number 4, it is not nestled among nerves and arteries.
I've never extracted from the basilic vein before, but this one looks so prominent. If I practice on this patient, they'll never know. Wow, all the veins are so prominent. Still, I should go for the median cubital vein.
Okay, collected the blood. Now we gotta get the blood back to the laboratory for analysis.
Hey Alice? Yeah? Why is the blood you just submitted in the EDTA tube clotted? Oh shoot! I forgot to invert the tubes! A large amount of specimens are rejected from the laboratory due to clots in anticoagulant tubes. Inverting the tubes after collection prevents a second puncture and provides accurate results. If not inverted immediately after collection, invert the tubes as soon as possible.
Okay, collected the blood, transferred the blood into the tube. Wait. Have to invert it at least 8 times because it's an EDTA tube.
Generally, drawing from the antecubital region or through hand veins are acceptable unless the patient has intravenous infusions, injury, or mastectomy affecting results on a certain arm. In cases like these, draw from the other arm or from other sites, such as the foot and hand veins if necessary.
Looks like he got an injury on the left arm. But I'm here already, so I should just try collecting from the left side. Looks like he's got an injury on his left arm. Oh, but his right side is clear. I'll go to the right side.
Patient misidentification is the most serious and most dangerous pre-examination error you can commit. Misidentification of the specimen can lead to erroneous results being given to the physician, and the physician misdiagnosing the patient. Always label your specimens in the presence of the patient, or else you might forget who the specimen belongs to.
Thank you for your time, Mr. Jones. Alright. 10 more patients to go before I finish my warding.
Alice?
Yes?
Did you bring in Mr. Williams' specimens just now? They don't have any labels on them. Oh, no, the first 2 were from Mr. Jones, then the third one was from Miss Andrews? No, I went to Mr. Williams next. Was it Miss Garcia's? Oh no!
Okay. Thank you for your time, Mr. Jones. Now, I just have 10 more patients to go before I finish warding.
Alice?
Yes?
Did you just submit Mr. Williams' specimens just now? Oh, I think it's the 4th lavender top tube and the 2nd light blue top tube. Oh, you can check the label too.
Got it. Thanks.
All right. By stretching the skin at the puncture site with the thumb of your free hand, you anchor the vein, which prevents the vein from moving, and it is also the single most effective way to minimize pain.
Okay, I'm gonna take your blood now. Okay, I'm gonna take your blood now.
In reality, you might not draw blood from every patient because it might be too difficult or you might be having an off day. After 2 failed attempts at blood collection, you should endorse the blood collection to another phlebotomist. Knowing when to quit shows your professionalism, and it ends the suffering of your patient.
Darn it, I couldn't draw blood again. Hold on, Miss Tracy. The 10th time's the charm. Well, Miss Tracy, since I wasn't able to draw your blood again, I'm gonna endorse the collection to another phlebotomist. Oh, thank God. Sister, it's so good to see you. I'm not your sister. I don't even know you. You're crazy. Good day. Can I help you? Hi. I'm just so lost right now. I'm supposed to have a blood test in the lab. Oh, don't worry. I'm a phlebotomist from the lab. I can take you there. In fact, I can help you with your blood test if you want. Oh, really? That would be great.
Treat all your patients like family, meaning treat them with kindness and respect. Just remember, as a healthcare professional, you can provide comfort to all your patients. Whether they are sick, injured, or having a bad day, your kind words and gentle smile might just turn their whole day around. I hope this video was able to educate you on the 10 commandments of phlebotomy. The real versus ideal scenarios should inform, entertain, and shape you into better phlebotomists even if you're learning online. Once again, this is the real versus ideal scenarios with the 10 commandments of phlebotomy by me, Dr. Chameleon.